Welcome to Thoughtful Thursdays, and we are lucky and delighted to have with us here today Dr. Annett, who is a breast surgeon, and she knows everything about breast cancer. And we know that breast cancer is a topic that is often discussed in society, and that a large part of the population has concerns about that. So with the expert in our studio, we're going to learn a lot today. How are you, Dr. Annett?
Thanks for the invitation. I'm very well. Thank you.
That's wonderful. So, what do you think that what would be the main advice that you would give to women in the population when it comes to the early detection, I would think, of breast cancer?
Breast cancer is a very common disease. So it happens initially in the breast from the milk globules or from the milk duct, from the inner lining. And it actually can happen to women mainly, but even to men. So this is very often forgotten that men could get breast cancer as well. And it's rare that we have a man in the clinic, but usually they come a bit late because they don't think of the disease. So my first message would be not only to women, even to men, to think about anything like that they can get it as well, even though that it's rare.
Yeah.
And for women, it is a very common disease. It is 1 in 8 women gets breast cancer nowadays. And by literature and even by experience, we see much more young women coming to the clinic with sometimes even advanced cancer stages. So awareness is the key, that we educate each other. We have a big job in the community to tell women, to tell men, to tell husbands, sons, daughters, to look after themselves and to look after other family members who might not be aware of breast cancer. To look after signs, to make healthy lifestyle changes or choices, and to get screened at the end of the day in an appropriate way and fashion. Even that can be monitored or managed or discussed by a breast surgeon.
At what age should women go for screening?
The Ministry of Health has made good recommendations. They're accessible for everyone online. So for a normal, healthy woman without any, let's say, family risk factors, it would be after 40 a biannual mammogram, which means every 2 years to have a screening done. This is what the clinics and hospitals can do. And otherwise, we discuss and we educate women how to be aware of changes on the breast, meaning self-examination, looking after their breast, feeling their breast in a regular way.
And does breastfeeding have anything to do with breast cancer?
Well, we know a lot about risk factors for breast cancer, like obesity, smoking, which is known, I would presume, or more known. But there are risk factors like having had radiotherapy in a young age, before the age of 25. This is something that surprisingly nobody really knows, but that's another risk factor. And then we know a lot about what can reduce your risk of breast cancer. Yes, not to smoke, to be lean, to be with a healthy BMI, to exercise, and to breastfeed, to have children at a young age, to have more children. And in all fairness, we know that breastfeeding statistically reduces the risk, but we have to be clear that everybody can get breast cancer. We see women who have 10 risk factors and they don't get breast cancer.
Yeah.
We see women who have done everything right in their life and they have breast cancer.
Yeah.
So it is statistically, these are risk factors. It's not if you live super healthy and you eat organic food and you exercise enough and everything is good, that you can't get it.
Yeah, I agree, and it's interesting to see that breast cancer is one of the few diseases that has a month dedicated to it every year, and it really stands out as that. And by now, really, because of the activity of those awareness campaigns, everybody knows that October is Breast Cancer Month. What are your thoughts about that?
Well, I love October. In October, we all go out. We talk everywhere. We talk in schools, which is interesting. Even when you ask these 12, 15-year-old kids, who knows anything about breast cancer? Who knows someone who has cancer or had cancer? More than 50% of the kids will raise their hands. So cancer is unfortunately in many families. And in October, we try to go in the communities. So it can be anywhere that we go and talk. Yes, we do these webinars, and we go to the Majlis Amal, which is a cancer walk-in center. We have talks over there, but these are all survivors, and we go into different places. October is nice. There are lots of screening opportunities in every hospital and clinic. But the other message is October is every day. So we women should be aware of our health every day of the year. We should check ourselves regularly once a month. And if there's anything, I usually tell my patients, if there's anything weird, if you think this is not the normal you, there's anything off, it doesn't have to be a lump. It can be any unusual pain that doesn't go away, if it's not related to your period, or if somehow the breast is changing size, anything subtle, something that's not the normal, please come and we have a look. So it's not only October.
Yeah, I think that's a very important advice. But you love October because you become very busy. And you're
No,
wishing
it's
that-
not in October. In October, we
Okay.
go more out
Okay.
and talk. We have the screening promotions like everybody else, which is good for women. It's not painful. It's not a bad thing to do a mammogram. And the mammogram is the baseline of doing a screening investigation after the age of 40.
Yes, how often should a woman do a mammogram?
Every 2 years.
Every
This is
2
the
years.
recommendation from the Ministry of Health. We look at different data as well. So we at times recommend every year. Then we look at women and their family history. So we take maybe a different history, and the family history is one of the risk factors. So we need to decide, even with risk models, computer programs, which we can use, or include a genetic counselor in the whole assessment and see, is there maybe a higher risk of getting breast cancer due to obesity, for instance, or to family history. And then we talk more about a different screening. That means starting earlier, telling them that their daughters need to come in or should come in and have a health talk. We include other modalities like MRIs in the screening. We talk about genetic testing if they want to do it, and then tailor-make their screening more, and even other things that we can do prophylactically.
So let's assume that a lady did a mammogram and she's 50 years old and they found nothing wrong. Should she still come at 52 and do a mammogram?
Yes, please.
She should still do that.
I mean, at 50 is a normal age to get breast cancer. This is a postmenopausal women. So every 2 years would be recommended. Yes.
Okay. And is there also an age, let's say, a lower limit of the age for doing a mammogram?
You mean before the age of 40?
Like if you are 28 or 27, is a mammogram useful, or is it too early to do it?
It's too early to do it. So screening starts at 40, or for high-risk screening, it starts at 25. But this is depending on the family history.
But
this
I-
needs
yeah,
an assessment.
Yeah, I
Yes.
understand that. What I think is that in October, because attention goes to breast cancer, some people might feel uncomfortable. They start to just think, oh, maybe I have it. And maybe then they would not follow these guidelines. They would say, look, I'm 33, but I want to be assessed and I just want to be reassured that I'm okay.
We can reassure this in other ways. The chances of having breast cancer at this age without any symptoms is very little.
So this would be a consultation,
a
an
consultation,
explanation.
health checkup, yes, a physical, taking the history, examining the lady. And if you're in doubt, you maybe want to do an ultrasound, which is without radiation. A mammogram is an X-ray, is a radiation. So you always need to have a reason, to have a guideline that supports that. So an X-ray for a very young woman will not help you that much. The breasts are young and dense, they are hormonally active. So the chances that you really see so much on a mammogram is little, and the chance that a woman has breast cancer without any symptoms is little as well.
It's much less,
So it's
yeah.
not it's
not
not
worth it.
indicated.
But getting these consultations can be very reassuring for a lady, knowing that she's speaking to an expert.
Yes, this can be an expert of any field. It doesn't have to be a breast surgeon. It can be a family physician. It can be a gynecologist. Anybody who is interested in breast and has some expertise can help these
So
women.
in your
Yeah.
personal view, which type of doctor should be responsible for the screening? Should it be under family medicine, or should it be under a breast surgeon like you?
Being a breast surgeon, of course, I would say we might have more knowledge on that. What we see often is that women are not sure how to check themselves. So I think a physical consultation still makes sense until they say, yes, I know what to do. I know what's good for me. If you detect it early, it is curable in more than 90% of the disease and the diagnose. But if it's detected early. So if you come later and it has gone to other places, it becomes more difficult. And the more advanced the disease is, the more treatment you're going to need. Yes, there are different types of cancer. Some of them are more active, aggressive, how you want to declare it, and will need more medical treatment, sometimes even more surgical treatment. But in all fairness, the medical treatment has advanced massively. I mean, literature and recommendations are changing by the week, and they are becoming more and more tailor-made for each woman, tailor-made for each cancer. And we discuss it in the tumor board, so what is good for each woman which is diagnosed. But breast cancer is not the end of life. Yes,
That's
it can
wonderful.
be difficult to undergo the treatment.
Yes.
It can take a long time. Some women take medication for 10 years to control the disease or to fight the disease. And I'm not saying it's easy, but it's curable. Please come early, check yourself, be aware of any changes, and the earlier you find it, from screening, for instance, the better it is.
I think this is a very important message, and even though there's a lot of caution in your words, it's also a positive message, because if people think that they might discover something which might be a very bad message, they might also be less inclined to go to the screening. But if they know that even if it's diagnosed nowadays, there are very good treatment options, and there are many people who can be cured if it gets detected early, then that might actually invite them to go and do the screening earlier.
There is no reason to keep it hiding at home if you find any change on the breast. It's not a stigma. It's not the disease. You have not caused it. It's not your fault. It's nobody's women's fault if they have breast cancer. They have not done anything wrong.
Absolutely.
So we should not stay at home and think, oh my God, they're going to do a brutal surgery. I'm going to have chemotherapy and then I lose all my hair. It may be necessary, but not all breast cancers need that.
Yeah.
So if there's any change, get screened, get checked, get it treated, get it diagnosed, whatever. And I think even we should try to be open, that it's not a stigma, and we should open up and tell other women, look, even I had breast cancer and I'm fine now. We see this much more happening. It was difficult to convince sometimes women, why don't you talk to someone? Why don't you come for a testimonial and open up and tell other women, look, I had breast cancer and I'm doing fine. But now it's actually the other way around. Very often in October, patients of ours, they come and say, listen, I want to talk to someone. Now I'm done with everything. My hair has grown back. I'm back to my job. Everything is fine. I feel the strength is back. So now I want to tell other women that they should check themselves, because I only had a little red flag and I followed it. I got diagnosed and I got treated and I'm okay.
Thank you so much, Dr. Annett. It's been so valuable to hear your expert advice and your expert knowledge about this very important topic. And it's really been wonderful talking to you.
Thank you. Thanks
I'm
for
very
the
thankful.
invitation. Thank you.
Thank you.